I'm Dr. George Thaler. I'm a geriatrician and co-founder of the Medical House Call program at the MedStar Washington Hospital Center. A house call is 21st century medicine in the guise of 18th century medicine. What we have found is that we have changed dramatically because of the successes of medicine, and we've changed the entire nature of healthcare from an episodic, short-term condition where you either lived or you didn't, to overwhelming chronic care. The emerging syndrome that's at the center of healthcare right now is advanced chronic illness and disability. The house call is actually a very powerful diagnostic probe. It tells us not only about the disease that we're dealing with, but the person with the disease. It's care that's tailored to the individual, far less expensive, and far more comforting and healing. And so the house call is actually more of a diagnostic tool than an altruistic tool. What's there not to like? There was a lady that I took care of 10 years ago. And we were managing her diabetes and her hypertension, all those other metabolic diseases, not terribly successfully because she cheated all the time. But we understood that and we tried to work around that, what I call cheating responsibly. And then she developed breast cancer. So we got her through most of that, but she had some complications of her treatment. And so she really couldn't take care of herself very well. And so she went out to Prince George's County to live with family who could manage a rather significant wound from her radiation therapy. Fast forward 10 years, and she develops a new cancer. She decides that she wants to come back into the city so that we could take care of her in her dying days. She did not remember my name, but she knew that I worked at Washington Hospital Center. So she came into the emergency department, and by luck, we reconnected. So I got a really big hug, and she said, "I knew you would be here."